United States is epically failing with preventative care. I think we all know that. It's really good at causing disease and managing the decline of disease, but actually educating people on how to eat, how to move their body, how to live day to day, and just basically survive as a human being, as the biological organisms that we are, failing.
Think about what you just heard, because there is something happening inside American healthcare that I don't think we are talking about enough. We are accustomed to hearing patients complain about healthcare. The bills are too high, insurance is too expensive, appointments take too long. People are fighting insurance companies over what gets covered. But now we are hearing something from the other side. Nurses are frustrated, doctors are frustrated, healthcare workers who spent years getting educated and trained to take care of people are now openly asking, or rather questioning, what is happening with their profession. And that's what makes this story different. Because when the patients and the people taking care of those patients are telling you something is not working, maybe we should start listening.
Here's why nurses are actually quitting. And no, it's not because we're lazy or we don't love the job. Let's be real about why so many of us are walking away from the profession. Reason number one is unsafe staffing. Almost every nurse I know says their unit is short. You walk into a shift already behind, 4 or 5 really sick patients in the ER or ICU with no tech, no secretary, and leadership still claiming it's safe on paper. You're set up to fail before you even hang your first med. Reason number 2 is burnout and mental health. Burnout isn't just being tired. It's that mix of physical exhaustion, emotional numbness, and this voice in your head that's just saying, you're failing everybody. You go home wired and empty at the same time. You're snapping at your family, sitting in your car after a shift, just staring, trying to convince yourself to go back tomorrow. Reason number 3, toxic leadership and gaslighting. You speak up about patient safety and ratios and get told that's just how it is. You'll toughen up. We all did. They send out self-care emails and pizza parties while ignoring every single thing we're telling them. And we tell them everything that's about what's really going on at the bedside. Reason number 4 is work and family. I mean, you work 12-hour shifts that turn into 14, rotating days and nights, back-to-back weekends. That might be survivable when you're 22 with no responsibilities. Try doing that with kids or as a new dad or while taking care of your own parents. At some point, you have to pick your job or being present for your actual life. That's why nurses are quitting. Not because we woke up one day and stopped caring. It's because caring in this system costs you your body, your brain, and your family. While the people in charge refuse to change anything that matters. If this sounds like your last shift, tell me in the comments, what kind of unit are you on? What's the number one thing pushing you out? No hospital names, just real reality, just your reality.
Talk about how physicians are not examining their patients anymore. That's like a thing of the past. When I see patients, every single patient gets in a gown and they're examined from head to toe. And patients will ask, what are you going to do to me? And I'll ask them, hasn't your other doctors been examining you? And they're like, no, they just sit and talk to me. And so as consumers, I think you have to raise the bar, demand better care. Why are physicians not examining their patients, getting them into a gown, taking their clothes off? Doesn't make any sense. The standards are being watered down. Sorry.
And here's the part that caught my attention. The United States isn't operating some small healthcare system that's struggling because nobody is spending money. It's almost the exact opposite. According to the Centers for Medicare and Medicaid Services, Americans spent about $5.3 trillion on healthcare in 2024. That's roughly $15,474 for every person in this country. So we're spending an enormous amount of money, which raises A simple question. Why does everybody seem so unhappy with what we are getting?
My wife and I just got a letter from United Healthcare telling us that they're denying coverage for our twin stay in the NICU. And if you thought that was inhumane, you're right. But listen to this. They didn't address it to me or my wife, like human adults. They addressed the letter to the baby. Sadly, I guess it is appropriate that our preemie baby's first experience in the world is having its healthcare coverage denied. I guess my only other question for United Healthcare is that if the baby was still in the womb, would you have sent the letter to my wife and had her eat it in order to get it to the baby?
I talked to a doctor on the phone for 10 minutes. Literally, I'm not exaggerating, 10 minutes, so that she could prescribe me antibiotics because I was shitting my brains out. And I got charged $400 for the call. I double checked with my insurance and I double checked with the clinic, and they both agreed this is how much it's gonna cost. My insurance covered $37 of the $400. Okay, so I'm basically begging the clinic, hey, do you think you could code this differently so it's cheaper? And the clinic's like, well, we have a cash pay option. We can just rescind the claim to your insurance and it'll be $120. It just won't count towards your deductible. Are you okay with that? Okay, so first of all, why didn't you lead with the $120 cash pay option that is significantly literally a quarter of the original thing I was supposed to pay? Second, why do I have insurance? Why do I have insurance if it's literally cheaper for me to just pay for the visit? I'm not crazy, right? This is crazy, right? Happy 4th of July. And I am doing the cash pay, by the way.
And I want to be careful here. A few viral videos don't prove that every hospital in America is falling apart. There are excellent hospitals, excellent doctors, excellent nurses, and millions of patients receive good care every single day. But these complaints shouldn't simply be dismissed as people complaining on social media. Because when you look beyond TikTok and start looking at workforce research, you find some of the same warning signs. The National Council of State Boards of Nursing reported in 2025 that more than 138,000 nurses had left the workforce since 2022. And its national workforce study found that almost 40% of nurses said that they intended to leave the workforce by 2029. Think about that. Not people thinking of becoming nurses, people who are already there.
Doctors are leaving corporate medicine in droves, and that has escalated in the past 3 years. You wonder why. So those that finally realized that what they were taught was really indoctrination start doing their own thing, and they start thinking for themselves. So from a doctor that I think this year left his practice to start his own, and this is what he said: 6 years of medical school, 4 years of specialty, 26 years of medical practice. It was all a lie. And it took me that long to realize, and 95% of my colleagues have not realized, that I'll start my good practice at the age of 58. Never mind, I'll fix my sins. I remember skimming through a book years ago written by an MD who decided to become a chiropractor. Many people asked him why he'd made the switch, as it puzzled many. His answer was, I realized I had spent years mopping up the floor when I could have just turned off the faucet.
Husband and I decided we were done with insurance, health insurance, so we just opted out. And our premium was going to go up $500 a month for a family of 4. But anyway, we're like, screw this, we'll just pay cash. I just had a mammogram, And what they charge your insurance, I got a letter that was like, oh, your estimated cost is $800. And I'm like, cheaper than what we were paying for our monthly premium. So I'll deal with it. And I get in here and they were like, oh, this is what the cost of a mammogram is, $1,500. But since you're no insurance, we are charging you $95. But since you're paying cash, you are only charged $75. And I'm just like, insurance is a scam. It's a scam. Same thing with my, with insurance, my primary care physician, I would get a bill and I would end up having to pay $175 for every visit that's with insurance. So I'm paying my monthly premium. And then as a cash patient, it's $95. I'm so sick of American healthcare. All these idiots.
And this is where the conversation becomes bigger than whether somebody likes their job. Imagine you lying on a hospital bed. You don't care about the hospital's quarterly numbers. You don't care about the hospital's administrative strategy. You don't care about somebody else's spreadsheet. You care about one thing. Is somebody going to take care of me? And the nurse taking care of you might have several other patients who are wondering exactly the same thing. That's why burnout in healthcare is different from burnout in a lot of industries. When the person burning out is responsible for someone else's health, eventually a workforce problem becomes a patient's problem.
The United States is epically failing with preventative care. I think we all know that. It's really good at causing disease and managing the decline of disease, but actually educating people on how to eat, how to move their body, how to live day to day, and just basically survive as a human being, as the biological organisms that we are, failing. Epic. We are the most unhealthy, medicated society out there. It's just crazy to me that people still don't see it. And it's just crazy to me that we're still pushing a medicated society. And not a lot of people are just talking about going back to the basics, about how humans, our ancestors, lived. Basic things, sunlight, rest, movement, real food. I don't know. It's just a thought that I was having, and I get that we need more preventative care. We need to be talking about the causation of everything. They're purposely putting stuff in our food that causes disease. Our air is polluted. It's causing disease. I've talked about this before in my videos, but it's just so important. We need to talk about it like every day because it's a huge problem.
I think there's another part of this that deserves our attention. Where is all the money going? Because whenever we talk about fixing healthcare, Americans are usually told that fixing it will require more money. Maybe. But before we arrive at that conclusion, I think taxpayers and patients are entitled to ask another question. What we are getting for the money we are already spending.
Who else is just as annoyed as I am that when you got to make a doctor's appointment, you don't get the girls behind the desk at reception anymore? No, every single doctor is now part of this big corporation where there's somebody in Oshkosh, USA that is making your appointments, okay? Gone are the days when I used to be able to call up and say, oh, hi, Cheryl, it's Deb. How are you? Can you do not even to make an appointment? What if I have a question for the doctor? You got to do a song and a dance to get to the office. I can't stand it. It makes me insane. And it's not just that. I had to call a company yesterday, right? I needed a piece of paper, a statement. I said, could you just mail it to me, please? Oh, we don't do that anymore. Well, what? I said, okay, well then can you email it to me and I'll print it? Oh, we don't do that. You got to log on and you got to create an account and I said, are you kidding? No. Oh, I'll stay on the line. I'll walk you through it. It took 54 minutes of my life to create this account. You know why? Because there were 54 glitches. That's why. You know what I said to her? I said, honey, guess what? You know what doesn't glitch? Paper. Paper don't glitch. How about that?
Home after my ED shift. It's 9 a.m. on a Saturday, And the whole way home, I was just thinking, I went to school for 20 years so that I could help people. I accrued $500,000 in student debt so I could get all the skills to be really good at what I do, and it is very rewarding. But, I'm working Friday, Saturday, Sunday, Monday night shifts in the ED this weekend. I make like $70K a year, comes out to less than $30 an hour. And all I could think was, damn, why did I do this?
And notice something about these conversations. A lot of these healthcare workers aren't saying that they hate taking care of patients. That's an important distinction. Many entered this profession precisely because they wanted to help people. What they are describing is everything surrounding patient: workload, staffing, paperwork, bureaucracy, insurance battles, and every administrative pressure that they have to deal with. That's a very different problem, because you can replace someone who simply doesn't like their career. It is much harder to fix a system that makes good people question whether they can continue doing the work they once loved.
Healthcare didn't break, we turned it into customer service. At some point, hospitals stopped acting like healthcare systems and started acting more like businesses. Now your job isn't just to treat patients, it's to keep them happy. So now you're expected to keep them alive, keep them comfortable, and make sure they leave a 5-star review. Even if you're understaffed, even if they're disrespectful, even if the situation isn't safe. That's how you get a system where bad behavior isn't just tolerated, it's rewarded. Because the customer experience matters more than the staff. And then everyone acts confused when nurses and CNAs are quitting in droves. Tell me I'm wrong.
Maybe that's the part of this story that we should be paying the most attention to. America doesn't have a healthcare system that nobody's paying for. We are spending trillions of dollars on it. Patients are paying the premiums. Employees are paying for insurance. Taxpayers are funding Medicare and Medicaid. Families are paying deductibles, copay, and medical bills. And yet we're hearing frustrations from patients, nurses, and doctors. So perhaps the real healthcare debate question shouldn't be whether America spends enough. Maybe we should start with a simpler question. Why are we spending so much while so many people in the system feel like they're getting so little? And I don't think there's one simple answer. Hospital will point to labor cost. Doctors will point to administrative burdens. Nurses would talk about staffing. Patient would talk about insurance companies and medical bills. Insurers will point to the rising cost of care. Everybody has an explanation. But somewhere in the middle of those explanations, there's an American patient who just wants to see a doctor, and a healthcare worker who just wants enough time and resources to take care of that patient. That's the conversation I think we need to be having. Tell me what you see where you live. If you're a nurse, doctor, paramedic, technician, therapist, or anyone working in healthcare, is the system getting worse from the inside? Or are these stories giving us a distorted picture of what's really happening? Let me know in the comments.